Hey guys, so let's talk about one simple strategy you can use to either generate your first 5 mobile physical therapy patients or just increase your caseload if you already have patients that you're seeing, but you just want a few more. One of my favorite ways to do this is to look outside the scope of basic physical therapy services. Now, of course, this applies to occupational therapists as well, but when we look at the individuals who would benefit from PTOT services in the home, many of these patients would also benefit from non-medical companion care services. So this is something that, as I research various cities, you can find that they're getting paid anywhere in the range of $25 to $35 an hour. Now, obviously, as a mobile therapist, especially if you're billing Medicare, you're going to be generating 100 to 120 an hour. So this is a big pay cut, but this is an entrance into building the relationships, gaining word of mouth, and really getting the momentum behind your practice. So what I would recommend you do is you have to understand local and state guidelines for what you're allowed to do and what you're not allowed to do. It's going to vary by state and location. But if I was sitting here looking to build my mobile practice and I wanted to get the word out and I wanted to start building relationships, one of the easiest, lowest hanging fruits for me to get started with is that kind of non-medical companion care, which of course would turn into a physical therapy, occupational therapy referral. And it might be something that even if you just start the ball rolling, you interview the potential client, you can make the determination then if this is an appropriate client for you or not. Nothing would say that you have to provide the service if this isn't the kind of client that you're looking for. But if it is the client you're looking for, then obviously if you were to look at doing maybe a 2 or 4 hour block of time, one of those hours could be Medicare covered services. The other 2 or 3 hours could be self-pay at that $25, $35 rate. And really, while you're doing this, you're building your business, building word of mouth so that maybe 3 months down the road, 6 months down the road, you no longer need to provide the non-medical companion services, or you can hire somebody to work with you who can provide those services as you continue to grow your therapy practice.